everyone. Today's topic of discussion is dengue fever. Dengue fever is a viral illness caused by dengue virus of the family Flaviviridae. It is transmitted by Aedes aegypti mosquito and sometimes by Aedes albopictus mosquitoes. These mosquitoes are commonly found in the tropical and subtropical areas and accounts to approximately 5% of fever in return travelers from these regions. Dengue virus is a positive single-stranded RNA virus. There are four serotypes of dengue virus, DenV1 to DenV4, that is, dengue V1 to dengue V4, and all of the serotypes produce a similar clinical syndrome. Infection with one serotype gives lifelong immunity only against that particular serotype of virus. Secondary infection with other serotypes produce severe dengue. For example, you may initially be infected with DenV1 serotype and gain lifelong immunity against DenV1. After a certain amount of days, you are again infected by DenV2 serotype, but you do not have immunity against that particular serotype and you develop severe dengue infection. The incubation period ranges from 3 to 10 days. Incubation period is nothing but the period between we first get exposed to the infection and the appearance of first symptom. There are three phases of dengue viral infection: febrile phase, critical phase, and recovery phase. Now let us go through each of them in detail. The febrile phase begins with fatigue and mild headache, which is experienced in the first 2 days, also called as the prodrome phase. The fever then sets in at day 3 and lasts up to day 7 and is usually a high-grade fever ranging from 103 to 104 degrees Fahrenheit. It is also called as saddleback fever. As the fever subsides on day 4 or 5 of the infection, we are then relieved that we have no fever. Again, on the next day, there is a steep rise in body temperature. You can imagine this as a temperature curve which steeply rises, goes up to 103, 104 degrees Fahrenheit. Then there is a gradual decline in the temperature where you find on a particular day that there is no fever at all, and again there is a steep rise in the temperature which goes up to 101, 102 degrees Fahrenheit, and this temperature then prolongs for up to 7 to 8 days, hence the name saddleback fever. You may initially notice a faint flushing macular rash on the first 2 days of infection, which later transforms into a maculopapular rash from day 3 to day 5, initially noticed on the trunk, which spreads centrifugally, that is, from center to periphery. The maculopapular rash usually appears after the high-grade fever subsides. Other symptoms include severe joint pain and back pain, called as arthralgias, and muscle pain termed as myalgias. It is also called as break-bone fever due to the severity of joint pains experienced. Other symptoms include pain on eye movements or pain behind the eyes, called as retroorbital pain, or you may also experience increased watering from the eyes. There may also be upper respiratory tract symptoms such as cold, coryza, sinusitis, etc. You may also have nausea, vomiting, loss of appetite, dysgeusia, which is a taste dysfunction where you only have sour, bitter, or metallic taste in the mouth, or there may be complete loss of taste. You may also experience extreme weakness and generalized lymphadenopathy, which is a generalized enlargement of lymph nodes in the body. The laboratory findings show leukopenia, which is decreased white blood cell count, thrombocytopenia, which is decreased platelet count, and elevated or increased liver enzymes like alkaline phosphatase and alkaline transaminase. The laboratory investigations to confirm dengue involves isolation of dengue virus from blood or detection of dengue virus RNA by PCR, enzyme-linked immunosorbent assay to detect the NS1 viral antigen, although it is less sensitive than the PCR technique. IgG and IgM ratios may be used to distinguish primary from secondary infection. Now let us go through critical phase. One very important thing to understand is that not every person affected with dengue goes into critical phase. It is most often noted in patients with secondary dengue infection or in people having pre-existing comorbidities like diabetes, hypertension, stroke, etc. The warning signs of critical phase includes abdominal pain or tenderness, persistent vomiting, increased lethargy. You may also notice easy bruising and bleeding due to thrombocytopenia and notice blood in stools, which may be bright red blood, black stools, which indicate upper GI bleeding, hemoptysis, which means blood in your sputum, menorrhagia, which means increased menstrual bleeding, hematuria, which is blood in your urine. You may notice that you're passing red colored urine. Epistaxis, which is bleeding from the nose, or any kind of mucosal bleeding, which means bleeding from the gums. Signs of fluid accumulation may be seen in the body in the form of pleural effusion and ascites. Pleural effusion is accumulation of fluid in the lungs, and ascites is accumulation of fluid in the peritoneal cavity. Hepatomegaly or liver enlargement is another sign noted during critical illness, which may be due to direct effects of virus or host immune response on liver cells, circulatory compromise, metabolic acidosis, or hypoxia caused by hypotension or localized vascular leakage inside the liver. Such cases need prompt medical intervention and proper therapeutic management as early as possible. We see more severe infection in the form of dengue hemorrhagic fever or dengue shock syndrome, in which there is increased vascular permeability, vascular leakage, fluid accumulation, respiratory distress, bleeding, hypotension, severe thrombocytopenia, multi organ involvement such as kidney failure, liver failure, central nervous system involvement, which is exhibited as confusion or drowsiness, and more severe infection calls for mandatory hospitalization and intensive care management. The terms dengue hemorrhagic fever and dengue shock syndrome are nowadays less commonly used as the newer classification groups these symptoms into severe dengue infection. Now coming to the recovery phase. This totally depends upon the severity of infection. Majority of people have a smooth transition from febrile phase to recovery phase, but some of them fall into critical phase. In recovery phase, we have gradual resorption of extravasated fluid, resolution of vascular permeability and hemorrhagic risk. You may develop a second rash or new patches of macular or erythematous rash, along with increased pruritus or itching, which may be seen appearing after the fever subsides. You may also have chronic fatigue and joint pains. There is no specific medicine available for the treatment of dengue infection, and the treatment recommended for dengue without warning signs is usually conservative management, which includes taking proper hydration, rest, and also consuming a good diet. Now, for hydration, you may not only drink water, you can also include rehydrating liquids like coconut water, fruit juices, warm soups, etc. Avoid fried and oily foods as it may exacerbate gastritis and lead to vomiting, stomach pain, and other GI related issues. Now, if you are into a habit of taking over the counter medications, make sure that you avoid taking ibuprofen as it has anticoagulation properties and may cause increased risk of bleeding. We all know that people with dengue already are into an increased risk of bleeding due to thrombocytopenia or decreased platelet count. So we don't want to add into that risk by taking ibuprofen. And above all, seek proper medical attention if you notice any warning or worsening symptoms immediately. Do consider to like, share, and subscribe to the channel if the topic was useful to you. Follow me on Instagram for more such helpful medical topics. Thank you.